when there's bladder issues and incontinence, how these are just all completely connected. They're all a reservoir for moving to the bladder. So our protocols, this is actually in a lot of Western medicine protocols that are being put out by the Journal of Urology and other groups, including even stat pearls. I like stat pearls. They're kind of a compilation of different protocols. So they do recommend probiotics. I would have people consider using a higher dose of oxalate degraders. So again, that's like our probiotic, Bifido Maximus. You want as many, oxalate degraders, because with mast cell and looking at oats, there's always a high oxalate content in the body. And again, these are different reasons, but usually it's from mold and candida, and maybe a compromised AGXT pathway. AGXT is our natural pathway to break down oxalates. So we can bolster that using glutathione and B vitamins. But the bacteria, we know they're missing. They're missing in some of the microbiome studies, and they're definitely missing in gut studies. Well, it's really interesting. Vasodilation helps with pain with IC. L-Arginine can be really helpful, but so can also pycnogenol. Pycnogenol has been known to raise NO levels. We know L-Arginine can also raise NO levels. So they can use 3 grams or 10 grams daily. No side effects were seen, but yet there was like some good improvements and reduced IC symptoms. Trying to help the bladder lining with GAGs, that's the glycosaminoglycans with that line the bladder. Those are all really helpful, very, very helpful, and reducing symptoms. So that can be chondroitin with sulfate and glucosamine with sulfate. These products also have an extra boost. They give sulfur to help with glutathione and NAC and regenerating these. Sulfur seems to have a good benefit with IC people and people with mold and Lyme without causing too many side effects or problems. Hyaluronic acid is also really great. Sometimes they'll instill it in the bladder. So these studies show that there's really great improvements, especially combined with other modalities. Some other modalities to consider is like pycnogenol. It's an OPC, kind of like cranberry for the bladder. This is even better. There was a head-to-head trial with cranberry for IC, and pycnogenol was combined was really great, but pycnogenol was better than cranberry. And again, I wonder if it's just cranberry is just too acidic for the bladder. It's too sensitized, because even tomato juice and other things are really, problematic. So quercetin, this is basically, the Western approach is basically a mast cell protocol. So they recommend quercetin. We use a lot of quercetin, 1 gram or even 2 grams, really helpful. In one study, it really helped with all different measures of IC pain control and inflammation control. So there's a diet. Basically, it's avoiding, it's all foods seen with gastritis that we'll go over tomorrow. Tomatoes, all the good foods, right? Garlic, avoiding anything like citrus and lemons and limes, and the list goes on and on and on. Coffee, even tea. Also, some of these are they contain oxalates, but mostly they're acidic. They're astringent to the bladder lining. One thing I'm not really going to talk a lot because it doesn't really work, but it's oral pentosan. And sometimes they use this with hyaluronic acid. They tried it. It's a drug. It's called Elmiron. It's really hard to get now in the U.S. Sometimes people obtain it, through different research sites or from Europe. It does sometimes work. If it does, it takes 3 or 6 months to happen. And there's a huge risk of eye problems and maculopathy. So not really, I'm not a big fan of that. And there's so many other solutions. I'm going to go over the protocol. So Tagamet, guess what? This is a whole mast cell problem. And using an H1 inhibitor like Atarax or hydroxyzine, or H2 blocker like Tagamet, cimetidine, which also has a lot of drug-drug interactions. So you got to be really careful about that if they're on mast cell stabilizers or other drugs. Medications like fluconazole or itraconazole, can't use cimetidine. Maybe consider ranitidine or other H2 blockers. But these are actually really helpful for interstitial cystitis. And that's because this is a mast cell problem, right? Bladder instillations, wow, this is terrible for people, I think. Just just having the invasion of the catheter is going to, potentially induce more bacterial invasion and infection just with the, procedure itself. But these do work. People report even 95% pain relief, which is, when they're at wit's end, this is really helpful. They used to instill gentamicin, terrible, right? But a lot of the cocktails, like Thomas Paine, he's a famous practitioner. There's the Paine, because he spells it his last name is Payne, but he would put in gentamicin, but it's not really encouraged anymore in the urology guidelines, and for good reasons, right? Because it's probably causing long-term fungal overgrowth. But they can even instill DMSO. It can be really helpful. Glycosaminoglycans, again, the GAGs with chondroitin being instilled in their HA, hyaluronic acid. Heparin sulfate is really great too. It helps functions as a GAG, and it is a sulfur donor. They also put in lidocaine, of course, and other anesthesia like bupivacaine. When they inject different parts of the bladder or the muscle, they can use botulism. They also use botulism in the bladder installation, can be really helpful. Now, when Western meets like regenerative, I've only seen it here in interstitial cystitis. They actually recommend some PRP and stem cells. They're really helpful. PRP contains peptides, of course, like all our famous, fabulous, amazing peptides are in there, growth factors and biological factors, and they found really great improvements. Mesenchymal stem cells, of course, awesome, right? Especially, you can also do exosomes as well. It helps with pain and fibrosis and overactivity. So interesting, there was a study in animals. They did NAC and melatonin with stem cells with these animals, and they found it hugely improving. And melatonin is actually is a peptide. It's like one amino acid. It's been around literally for 1 billion years, and it's apparently having really great benefit for any kind of lining. So for gut, it's really awesome. I think there's some studies where higher doses weren't so great for gut healing, but in this mouse model for IC, it seemed to help, especially better than stem cell alone. So again, you want your oxalate degraders. All these species are oxalate degraders in the gut. We want to promote them if they're possible, especially if they're histamine free. It's really great for people with mast cell, and they're D-lactate free. So those